Thanks for listening to the Pharmacy Podcast Network.
This is Pharmacy Crossroads with your host, community pharmacy business veteran, the road trip guy, Bruce Nealand. Community pharmacy is at a crossroads. Pharmacy owners across the country are evolving their pharmacy businesses and making a bigger impact on their communities. Bruce talks with the most innovative community pharmacy owners, pharmacy industry experts, and people who are passionate about the business of pharmacy and its impact on community healthcare. Pharmacy Crossroads is a member of the Pharmacy Podcast Network. And now, here's our host, Bruce Nealand.
Well, hello again, everybody. This is Bruce Nealand with another episode of Pharmacy Crossroads. It's sure a delight to be able to do these podcasts. I get to meet some wonderful people, and like today, I get to re-engage with people I've known for years and respect. So for today's episode, we have Chris Antypas. Chris is the president of Asti's South Hills Pharmacy in Pittsburg. He's also a partner and an entrepreneur in a variety of other healthcare or pharmacy-related businesses, which will be the subject of our conversation today, what he's building and how he and his partners are bringing an exciting and new technology that will benefit pharmacies and patients and payers. So it's a trifecta win for all of us. Chris is the past president of the Pennsylvania Pharmacists Association, which I just really admire pharmacy owners who get involved in their state pharmacy associations, national associations as well. What's fun for Chris being the president of PPA is I was actually on the board of the Pennsylvania Association back in like 2002, 3, and 4. So it's kind of near and dear to my heart. Joining Chris today, which is a real pleasure for me, is my daughter, Robyn Amberg. Robyn has introduced me to Chris and has made arrangements for us to do this podcast today. Robyn's been in the business, the industry, for about 15 years. She gets to work with some remarkable companies and bring new and innovative things to pharmacy owners. And so a little bit later, we'll get a chance to hear from Robyn. So for right now, Chris, why don't you take a minute and introduce yourself and set the stage for what we're going to be talking about later today.
Yeah, great to see you, Bruce, always, and good to be with you, Robyn, as well, my dear friends. So yeah, I've got a few things going on in my world. I have a few different pharmacies that I own. You mentioned Asti's. That's a retail pharmacy that we're decently high volume retail pharmacy. I have a closed door long-term care pharmacy called Colt RX. We also have a sterile and non-sterile compounding lab. I have a clinic-based pharmacy that does 340B, and I also have a nationally 50-state licensed specialty pharmacy that's in the specialty space. And my experience across all these different walks of the pharmacy world have driven me to do what I can in this space to try to innovate and compete. I mean, as you know, Bruce, the industry is like we're under duress, and we've been under duress for more than a decade, where our brothers and sisters, fellow pharmacy owners, have been forced to close their doors, sell their businesses if they're lucky. They're getting paid nickels on the dollar, basically, for their businesses that they've put their life into. And so those of us that are, fighting for survival, we really do have to innovate in our businesses to stay relevant and to compete in otherwise really, difficult and turbulent waters.
So, Chris, that's a wonderful introduction, and thank you for setting the table for the discussion. So now that we know who you are, bring us up to speed on this new technology you and your partners are bringing to the industry, and help us understand a little bit about how and why we should be excited about all of that.
So I've gone the route of trying to leverage technology in ways to basically demonstrate the value that the pharmacist has in the healthcare supply chain. And I think that's our biggest asset that we have and what we need to leverage in order to, continue to fight for fair compensation and also to win business. So some of my business partners and I, we launched a technology platform. We call it Medesto. And the goal, the problem that we're solving, I think it's a fundamental issue in healthcare that we're trying to solve. And I think that it can only practically be solved at any type of significant scale using technology. The problem is that our industry is hyper focused on drug cost. What do drugs cost and how do we get drugs for less money? That's the age-old battle. You've got payers battling with drug manufacturers. It's kind of like that old Spider-Man meme where everybody's pointing at somebody else like, hey, who are you? Or who are you? It's you, it's you, it's you. And you got the PBMs in the mix saying, well, drug prices are high because of drug manufacturers, and the payers are, trying to maximize their rebates. And it's just a disaster, but it's hyper focused on drug cost. And pharmacies are caught in the crossfire because we're the ones that have to sell the drugs. And so we're getting paid less, but the wholesalers and the drug manufacturers are trying to preserve their margins. The elephant in the room, from my perspective, is the fact that the price that you pay for the drug is only part of a very important equation. The most important part of drugs and drug utilization is whether or not the drug actually works. Getting a discount or paying a good price or a deep discount on a drug that does not work is not a good deal. The real objective when taking drugs and paying for drugs, it's pharmacy is viewed as a cost center, and the goal is to reduce the cost. The reality is that pharmacy is an investment center, and we should be hedging our investment by doing everything we can in our power to ensure that drugs will work in the patients that take them. The overwhelming tool that we use to manage disease is through the use of a medication. When people go to the doctor, it's like 70, 80+% of the time they're prescribed a drug. And so we rely on drugs to manage disease, but the discussion ends once we confirm that we got a good price for it. And I believe that the pharmacist is the completely untapped resource and asset that can be used to help get those drugs to a desired outcome. Because even when, we know that drugs don't work in everybody for a variety of reasons. Like if you look at clinical trials, not everybody benefits from the drug in the clinical trial, and that's even in a very controlled environment. But when you add reality to these equations and you have social determinants of health and you've got all kinds of factors, people don't take their meds correctly, or they don't store their meds correctly, or they just forget to take it, or they choose to take it differently. There are all kinds of variables that we can control that will affect whether that drug is successful. And I think that pharmacists have an opportunity to step into that role, own that. But as I said, I think the only practical way to be able to do that is through technology. And that's what we've built. And that's what we're trying to get in the hands of pharmacists so that they can demonstrate that value as the healthcare system is on a crash course. Like it's like the age old, illustration of the train on the tracks. It's heading towards a gully. The tracks are out. Like that's where healthcare is. We cannot continue to just burn so much money, especially on waste in healthcare. And to me, that's a huge opportunity for pharmacies.
So, Robyn, let's bring you into the conversation again and provide us some insights, help set the stage again or provide some more details on what you know about what Chris is building and all that kind of stuff.
Yeah, no, thank you, Dad and Chris. It's always fun to connect with people who I truly enjoy and admire while focusing on pharmacy. So, yeah, I've had the opportunity over the last 12 years to really get to know the independent pharmacy space, the community pharmacy space, and my current opportunities. I'm even expanding that to talk about learn more about other pharmacy models, as you mentioned, Chris, specialty, long-term care. And, the thing that I think is always great about this industry is at the end of the day, when everybody does their job right, we should be making patients healthy. And it's basically an altruistic industry that obviously is commercialized and monetized, and there's opportunities to spread that wealth, but we got to focus on the patients, and that's a noble cause, and I appreciate, and that's one of the things I love about being in this industry. And knowing you, Chris, I mean, the thing that, first of all, you've always been an example of, finding ways to make change and own the problems. And, as you laid out, so much of the focus on pharmacy today is that drug cost, and so little of that is anything that pharmacy can control. And looking for things that a pharmacist can do to take back control and really focus on the outcomes, I think is always a valid use of time and energy and resources. And, you talk about, first of all, innovate. And I always think about, as I work on bringing new solutions into the market, being innovative is never easy. You're always at the forefront of doing something first, those early adopters. It's not usually comfortable when you're innovating. But when you innovate, you end up differentiating yourself and making change. And I think that's what pharmacists ultimately want to do as they run their businesses. So I always applaud you and your efforts on what you're doing in this space.
So, Robyn, thanks for that perspective. It brings a lot of light on what's going on. Do you have a question or two you'd like to ask Chris that our audience might appreciate having the answers to?
I do want to ask a couple questions about this. I go back to Chris, I guess 20 years ago, maybe a little bit more, that, the STAR measures were introduced. And I remember working with pharmacies on really talking about, hey, if you build systems that allow you to identify the right patients and make change in their outcomes, it will impact your business in a positive way. And that was a hard shift because pharmacies didn't have the tools and they didn't know, and it wasn't an immediate benefit. And as we know, it really didn't end up being a huge benefit at all. But at the end of the day, getting pharmacists to think ahead is a tough job because, as you mentioned, they're survival mode right now. They're trying to figure out, how do I stay open for another 12 months? I mean, what do you do to tell pharmacists that if you really invest in making sure that the drugs are working and you're taking care of patients, that this will pay off in your pharmacy and you're building a model that's going to change how they survive going forward? How do you get them to think that way?
Yeah, I think that is a fundamental barrier for much of the industry, I think, is the mentality of the pharmacy owner. And I say this with all due respect. I mean, it's a lot easier for me to, get creative and innovative because I have a team of people that are, dealing with the day-to-day challenges that are highly distractive and consume a lot of energy to address. That is one of the advantages of having business partners. You know, a lot of pharmacy owners are solo owners and they don't have a team. So I think that is an inherent challenge that is, you know, that is a limiter. At the end of the day, they've got to dig deep and figure out how they can embrace some of these innovative concepts. Medicare star measures are focused on what has been espoused as an outcome, but it's not an outcome. Medicare star measures are based on adherence, and adherence is not an outcome. We talk about it like it is. Getting good adherence is good, but the reality is that it's a means to an outcome. If you take your medicine, you might get better. Getting better is the outcome, or addressing whatever you're trying to address. Like, every drug was approved by the FDA to do something that is measurable. So what is the actual measure? Well, it depends on the drug. It depends on the condition. But every condition has something that can be used to measure it. And those elements are either or a combination of patient-reported outcomes plus some type of medical data. That could be a lab value. It could be an image of some kind, right? With certain cancers, the metric of improvement is the size of the tumor. Well, how do you measure the size of the tumor? Well, you have to have some type of imaging done. Or it's some other indication that is measurable and objective, like we're supposed to reduce falls. How many times did the patient fall? Well, they didn't fall. So we improve their condition because they're not falling, or they're able to walk from point A to point B without any assistance. Those are outcomes. In order for a pharmacy can influence those outcomes based on how the patient uses their medicine. Appropriate medication use and all the variables that go into that. Appropriate storage, appropriate administration if it's a self-administered drug. Like, the pharmacies dispense drugs that are self-administered, inhalers, injectables, etc. If the patient doesn't use it correctly,
I mean, all pills
correct,
are self-administered.
Obviously, a pill is pretty straightforward. You consume it. But if it's not something that you consume, you got to apply it correctly. And we've seen patients do crazy stuff that we can influence.
Yeah.
One of the big variables, Bruce, that you alluded to based on, and what Medesto does, is Medesto can access the information in the patient's medical record. We can see all of their lab values. We can see all of their vitals. We can see all of their notes from physicians, all of the radiology reports. We can access all of that information through Medesto, so the pharmacist can see what is going on with the patient.
That's huge, because pharmacists have always tried to position themselves as that central point of care, and putting all of that together in one place has got to be the first time that that's really happening on a comprehensive level.
Yeah, I don't know of anybody doing it in pharmacy, typically because the whole argument is pharmacy is about reducing drug costs. It's like, how do we get drugs for less money? So
right,
by giving the pharmacist visibility to that medical information, the pharmacist already has a relationship with the patient where the pharmacist can gather those patient-reported outcomes. So what Medesto does is it makes it easy for the pharmacist to obtain those patient-reported outcomes by leveraging what's called a progressive web application. It's kind of like an app you download, kind of like a mobile-friendly website. It's neither of those. It's like the best of both, making it accessible for patients to access this, what we call their health feed, by just touching a link in a text message, bringing it up on their phone, and now we can interact with them, and we can send the patient structured assessments that can gather information about their condition. And then the system, Medesto, ingests what the patient says, marries it up with the medical data that we have on the patient to draw a conclusion as to whether that patient is at their therapeutic goal or they're not. And if they're not at their therapeutic goal, are they trending towards it, or are they trending away from it, or are they trending in a direction where it doesn't appear they're going to get there? When we have that knowledge and we have that assessment, again, all of this being completed automatically, the pharmacist doesn't have to go out and start gathering this stuff and review it. The system can review it, and the system presents the pharmacist with the situations that need their attention. This patient is trending in the wrong direction. This patient does not appear at their therapeutic goal. We now have the opportunity to dig deeper and say, okay, hey, Bruce, it doesn't look like the numbers are where we would expect them to be 3 months into your therapy. What's going on? Talk to me about how you're using your medication. Talk to me about how you take it. Are you having any issues with it? And we're going to reveal some of the things that may be contributing to that drug not working. It may be that you're doing everything correctly, you're taking it when you're supposed to, you're storing it correctly, so on and so forth. It's just that you're not responding to the therapy. But as opposed to waiting 12 months for you to go visit your doctor and have a lab test done or whatever, and the doctor says, no, we're not really too pleased with it, we know now that there's an issue, and the pharmacist can be the one that champions the intervention to address it. That is we can accomplish that through technology. And that's what Medesto is. So there is now, and I believe there is on the horizon as well. Medicare just launched yesterday the Access program. Pharmacies are being hammered with this. So if you don't know about the Access program, I'd love to know the rock that you're living under, but you got to look into the Access program, because this is very different from STAR measures, because it's actually paying for outcomes. Now, like with all things in pharmacy, we've got some barriers we've got to address with the Access program, but the very essence of this program is to reward providers, including pharmacies, for delivering patients to their clinical outcomes. And that's with a handful of diseases, but it's an absolute sign that there are ways for pharmacies to be paid for outcomes.
The fact that Medicare has finally made this shift is really a giant leap of where pharmacy has been asking to go and healthcare has been asking to go. So
yeah, it's a monumental step in my opinion, and it's really significant. But it also puts the pressure on us to demonstrate that we can make a difference.
Right.
And what pharmacists are historically we've done is just we've relied on these manual processes. We've relied on our pharmacy management systems. And I say this with all due respect to the PMSs. Like, it's not easy to be a good PMS, but you can't be a good PMS and do everything else great. It's right. Not, you can't be great at everything. And I don't love, as a pharmacy owner, having to have multiple platforms and all this stuff. Like, I realize that that's a drag too. But we have to reevaluate how we operate on a daily basis. And there are tools out there that we can leverage. And if we can demonstrate that we, the patient's pharmacist, can influence their clinical outcome, and we can now start getting paid for it, that's monumental. But the horizon opportunity, in my opinion, Bruce and Robyn, is that we cannot continue paying for healthcare the way that we've been, especially when we know that there's so much waste. We know that drugs are being just wasted on monumental scales. The patients come into our pharmacies with these unused medications, and we want to blame mail order, and it's absolutely true. Some of the conflicts of interest out there that are just burning cash. But we can step into this role and demonstrate to the payers, the plan sponsors, above and beyond Medicare, because there are other payers like employer groups and Medicaid plans, that they need this pharmacist in their network to support helping their members get to a desired clinical outcome.
Hey, Chris, let me jump in for just a moment. We're getting short on time. How does, if a pharmacy owner is interested in what you're talking about, wants to find out a little bit more, how can he learn more about Medesto?
Yeah, so they can reach out they can reach out to me. Medesto, we have a website. It's called medestohealth.com. So they could go to medestohealth.com, medestohealth.com. One of our visions is to be, and we're working on this now, we have several that we're working through bi-directional APIs to pharmacy management systems to reduce the burden of having multiple platforms where you don't have to operate and do the swivel chair. The system can automatically drive it. Now, you'll need to react and respond to the alerts. It's an alert-driven system. So system goes out and does the fishing of the information, reviews that information, identifies alerts that need to be addressed, and then the pharmacist goes and addresses those alerts, documents it accordingly, and then of course, obviously, we need ways to share that information and then report on it, and so on and so forth. And this isn't a technical dive on what the system's capabilities are, but the point is that it can do that. And at the same time, Medesto is also built to help facilitate pharmacy operations and the interactions with patients. So there's so much more that it does, but at its fundamental core, it is a technology platform that's designed to elevate the pharmacist to their rightful place in the healthcare ecosystem, to demonstrate that we can impact metrics and values that matter. And when we do, we reduce the total cost of care. Pharmacy cost is one part of the equation, and medical costs are the other part. And to the extent that we use medications appropriately, we can, I think, reduce both of them. But obviously, if people are using their meds, they're going to have to buy them, and there's going to be a cost to it. But the total picture is what comes into more focus when the pharmacist is integrated and involved in patient care.
And like we said in the beginning, just the final note on that, we're preparing now for that horizon. So it's great. So thank you.
Wow, Robyn and Chris, thanks to both of you. This has been not only informative, but it's exciting. This Medesto product that, Chris, you're bringing to the market, and you tell me that there are already pharmacies using it, and you're getting positioned to roll this out so that more can take advantage of it. It's time for us to wrap up here, so I'm going to say thank you, Chris, and thank you for Robyn. It's always a pleasure chatting with you. And again, for my listeners, remind you that's Medesto Health, MEDESTO health.com. And that's it for today from Pharmacy Crossroads, where our motto is helping pharmacies do more and be better. Good day.
Thank you.
Thanks for listening to Pharmacy Crossroads. If you're interested in talking with Bruce, please contact the show. Visit pharmacycrossroads.com. We look forward to hearing from you.